This is the 10th slide in this series. You can see you are looking at the pelvis from the inside. This is the outer surface of the pubic bones. This is the pubic symphysis. This is the right pubics. This is the left pubic bones. This is the obturator foramen. This is the space, retro-pubic space, immediately behind the pubic symphysis and the pubic bones. This space is filled with fat, and it is the site where the urethra traverses the pelvis and is lying anterior to the bladder. You can see this is the bladder. This is a peritoneal cavity, and this is part of the peritoneal cavity of the pelvis. You can see this is the cervix, the lower part of the uterus, where it is at the level of the entrance of the ureters, where they enter the bladder. This is the pouch of Douglas. This is the vesicouterine pouch. This is part of the pelvis, pelvic cavity. This is the rectum. This is a potential space lying anterior to the sacrum, known as the presacral space. This is a sagittal section showing the right side of the female pelvis. This is, you can see the plane of the pelvis is tilted in this angle. This is the bladder. This is the vesicouterine pouch. This is the rectouterine pouch of Douglas. This is the vagina, urethra, anal canal. All three are piercing the levator ani, the pelvic diaphragm. This is the anterior upper third of the rectum, which is covered anteriorly and from the sides by peritoneum. This is the middle third of the rectum, which is covered only anteriorly by peritoneum. This is the lower third of the rectum, which is not covered by peritoneum. This is the end of the start of the urethra and the end of the bladder, the bladder neck. This is known as the bladder neck. But the bladder neck is the internal urethral sphincter, which is involuntary, as we have seen. This is the symphysis pubis. This is the sacrum. This is the first bone of the sacrum. This is the first vertebra. They are fused, 5 vertebrae. The urethra is a short urethra. In the female, it is about 4 centimeters in length. The external urethra meatus is at the urogenital diaphragm, but it is less well developed than, that's to say, the urogenital diaphragm is less well developed than that of the male. It means that the sphincter of the urethra is not like that of the male. In the involuntary internal sphincter at the bladder neck appears to be more important in the female, while the external sphincter is more important in the male. This is the triangular structure or the shape of the bladder. This is a triangle, which is the posterior wall of the bladder. This is a triangular shaped superior wall of the bladder. These are the two lateral surfaces of the bladder. These are the three openings of the bladder. The urethric openings are at the posterior lateral surfaces of the bladder. This is the trigone of the bladder, the most sensitive area of the bladder. The lateral, inferior-lateral surfaces of the bladder are resting on the elevator ani on the pelvic diaphragm. You can see, if you are looking at the bladder from the posterior surface, that the vast difference which is coming from the testis. Suppose there is a testis there. It is the vast difference is leaving the testis and coming into the cord, testicular cord, entering the pelvis, and here it is crossing the ureter. Always the genital structures cross the urethric structures. So that this is the vast difference which is crossing the ureter and going behind the bladder on this posterior wall. This is the ampulla of the vast difference. This is the seminal vesicle. This is the ejaculatory duct which opens into the prostatic urethra. Of course, what is posterior to this structure is the cul-de-sac, and the rectum is lying behind.